All right, welcome to the posture related pain course. You've taken the quiz, you've been classified into this course, this video, and you've already watched the intro video. Hopefully that answered all your questions. If not, please leave some comments, reach out to my team, make sure that we can get you in the right place and doing the right exercises to feel your best. So, posture-related pain is pain from sustained positions or posture, and it's managed through postural education and movement breaks. So we're going to go through this now. All right, so the learning objectives is differentiate posture-related pain from other pain categories, and then perform a sustained posture test and see if you get relief after doing the correction to that test. This will help to ensure that you do have the posture related pain, and then we can give you the management, the self-management, home management strategies to stop this pain. So let's look at a real world case study. This is Sarah. She was one of my patients. She's a software developer, and she gets some low back pain after sitting at her desk. And it usually happens after about 2 hours, depending on how stressed she is or what project she's working on. And she can get this pain to go away. If she stands up, if she moves around, if she takes a micro break, the pain does improve, but then it comes back a couple hours later. So this is very typical of posture-related pain, and it happens because of posture. And so in this course, I'm going to give you the tools to be able to get rid of this pain and to manage it long-term so that it doesn't return. So let's look at how this type of pain compares to some of the other types of pain that we may see. So posture-related pain is a pain from prolonged static loading of normal tissues or from being in a certain posture for a prolonged period of time. It's intermittent. It really depends on your posture, whether or not you have pain. It happens when you're in a certain posture for a sustained period of time. That's different for everybody. For some people, that's 20 minutes. For others, that's an hour, 2 hours, 3 hours. And when you do the movement screening, looking at flexion and extension and lateral movement, there's no real effect. You don't notice any change with your pain pattern. And when you correct your posture, when you improve your posture, you get some immediate relief. It may not be complete relief, but you do feel some relief. So this is different than what McKinsey calls derangement. We're not using that term in the other tracks in this course, but it's important to compare the posture against derangement. So derangement is pain and some movement loss. The onset is at the end range, so at the very end of your movement. And there is centralization and peripheralization when you do those movements, and the pain changes with movement. So this one is very tied to movement. And then there's dysfunction. So that's pain and also stiffness. So there's a limitation in the movement. You're not able to move into the full end range that you're capable of. And you feel it as you start to move towards end range. You feel a stretch or a pulling or a tightening as you move into the end range. And then as you move closer, you start to get pain in that end range. And so that pain happens because there's an elongation of, we're calling it tissue scarring. That's the terminology that McKinsey uses, but it's really any kind of damaged tissues The elongation of that causes this pain pattern. So that's kind of the differential diagnosis. You're in this course because we believe, based on your quiz results, you have the posture-related pain. But if you notice with that it's not working correctly, it's possible you have derangement or dysfunction. That's why I wanted to introduce those. So let's start with the test. So you're going to slump, basically. You're going to sit in a slumped seated position for 2 minutes. And you're going to notice if after sitting there for 2 minutes, you start to have some discomfort. This might not be pain, but any sort of discomfort, stiffness, and really pay attention to the location. Is it the upper back? Is it the lower back? Is it the hips? And then also the intensity. How strong is the discomfort or pain when you're in this position? And then correct your posture. Sit up nice and tall, nice and straight. You may even want to put a pillow or a lumbar support on your low back as you sit up. And notice how that discomfort changes. Is there immediate relief? Is there some relief? If so, then it's likely you have the posture-related pain, and this course is going to be perfect for you. So again, watch for the onset of timing. Maybe 2 minutes isn't long enough, and you need to sit in this slumped position for longer. And notice how long it takes for resolution to happen. This is diagnostic for posture-related pain. So you can also do this in other positions. You don't have to do it in a seated position. You can do it standing. So you can do this slump standing position with the head forward and the rounded shoulders. Again, holding that for 2 minutes. You could do this lying down as well. This is not a great image of that. This would be basically the treatment for lying down, but you could lie down kind of on your knees, all slumped over there. And that would be an indication here. Sometimes people overcorrect and they're actually in a more postural extended position, and that can cause discomfort. But for most people, it's the slumped flexion position that is a concern. So let's just recap these key characteristics of posture-related pain. The pain is intermittent. It's related to a specific posture. There is no loss of movement or function. The symptoms are reproducible with a sustained slumped position, and it's relieved when you get out of that position or you overcorrect into a position that's not poor posture.